GPs get a lot of negative press. They don't work hard enough, they aren't seeing enough patients, they're lazy, they're this, that, or the other. Many of these headlines are just plain rude, but clearly they highlight an issue, that patients are not happy with the standard of care that they receive. But let's take a step back and ask why that is. Hi and welcome back to the channel. I'm Sanjay and I'm a GP, so I obviously have a vested interest in this topic, and I might be a bit sensitive to these negative headlines. Look, we completely understand that many patients are not happy with having to wait sometimes 3 or 4 weeks or more to be seen, but instead of directing that anger at GPs, might I suggest thinking about why we are in this situation? GPs are doctors, we're not politicians and we're not policymakers. We also don't have infinite resources to do everything. We are handed a strict budget through a complex system. The bottom line is that GP practices don't have enough money or resources to fund all of the services that their patients need. Another reason is that people are living longer than they used to because we're better at treating illness. However, that also means that people are living longer with chronic conditions, such as hypertension, COPD, or diabetes, amongst others. Whilst the increased life expectancy is definitely a good thing, this means extra pressure on primary care, as we are expected to look after these conditions. The other issue is that there isn't enough GPs. This isn't a new problem and this isn't unexpected at all. The Royal College of GPs anticipated this and lobbied the government to try and sort this out, but for some reason the press tend to blame GPs for this gap, even though we have no control over the training and recruitment of new doctors. Now let's look at the kind of services that GP practices are expected to cover. Appointments with a GP who is a doctor, but also appointments with nurses, healthcare assistants, and even pharmacists. GP practices are expected to offer treatment for acute issues, but also long-term care for chronic conditions. So we need to show that we are reviewing patients with these conditions a few times per year. So for example, anyone with high blood pressure or diabetes or asthma needs to be reviewed at least once per year for each of these conditions. They're also expected to cover additional services such as vaccinations, cervical smear tests, and maternity checks. And we're contracted to cover these services during core hours, which are again dictated by the NHS and not ourselves, from Monday to Friday between 8 AM to 6:30 PM. You probably know much of this already, as you may have seen your own GP for these issues. But how much do you think that your GP gets paid to treat you for these appointments? You might think that we get paid per appointment, so that the more you attend, the more we are paid. But that's not how it works. We're actually paid a fixed fee per patient per year, which varies depending on a calculation of how frequently someone in your practice's demographics were likely to see a GP. To give an example, for a practice with a large proportion of younger patients, such as a university practice, which covers mostly students, they are paid less money than a different practice which covers mostly elderly patients, because typically older patients will have more chronic medical conditions and need to see a GP more frequently, which makes sense. However, on average, in England over 2020 to 2021, GP practices were given about £160 per patient to cover everything that they may go to their GP practice for during the entire year. That means regardless of whether you see your GP once per year or 20 times per year, they would still get paid just £160. But bear in mind that this is an average, so some practices will see less than this, maybe just £90 per patient per year. If you're young, fit and healthy and rarely need to see your GP, that might still make sense, but bear in mind that the number of patient contacts with their GP practice have increased dramatically. For example, young patients in their 20s and 30s were previously expected to see their GPs infrequently, and this calculation I referred to earlier reflects that fact. However, the number of young people seeing their GP now has risen compared to 10 or 20 years ago, as there's been a significant rise in mental health issues such as anxiety and depression. And these often require follow-up phone call or in-person appointments every few weeks to check in with the patient and see how things are progressing. And to give another example, if there's an elderly patient with diabetes who's developed a foot ulcer, as diabetics are more prone to this, they may need their ulcer dressed once or twice per week for several months, taking up dozens of appointments per year. Essentially, people are accessing their GPs much more than they used to. In the past 5 years alone, despite there being 1,600 fewer GPs, the average number of patients registered per GP practice has increased by about 25%. Some people say that GPs are lazy, yet a report published by the European Union of General Practitioners and the British Medical Association recommends that in order to maintain a safe level of practice, GPs should have no more than 25 patient consultations per day. However, we know that at present, GPs have an average of 37 consultations per day. Again, this is an average, so some GPs are seeing much more than this, up to 40, 50 or even more consultations per day. Now let's go back to that figure of £160 per patient per year. And let's compare this to other common expenses you may have. How about getting a haircut? Well, the average person in the UK spends about £180 on haircuts per year. How about getting broadband for your home? Well, the cheapest would probably work out to about £240 per year. What about pet insurance for your dog? Well, that would cost between about £170 to £280, depending on what dog you may have. Now, these may seem like unfair comparisons because they're completely unrelated activities, and you're right, but it does help to put these values in perspective. But now let's compare this to seeing a GP privately in the UK. If you had just one 15-minute appointment, that would cost about £50 at a private GP. So seeing a private GP just 3 times per year would essentially use up your quota that would cover a year's worth of NHS GP care. Suddenly it doesn't seem all that much, does it? Now let's look at where that £160 of NHS GP care goes to, because it not only has to pay for all of the equipment used for things like blood tests and smear tests and PPE, but also to pay all of the staff's wages as well. And not just the GPs themselves, but all the reception staff, the secretaries, the cleaners, as well as all the other clinical staff, which might include nurses, healthcare assistants, pharmacists, paramedics, or anyone else employed by the GP practice. I guess the point I'm trying to make here is that NHS GP care is extremely cost effective for the services that are provided. Having said that, I don't think any GP believes that this system is perfect, and we would more than welcome more resources if that meant that we were able to provide better care for our patients. But hopefully the next time you feel underserved by your GP practice, you might want to consider speaking to your local MP about this, rather than blaming your GP, who has absolutely no control over this. I hope you found this video informative. If you'd like to know more about this kind of thing, let me know and I'll be sure to cover more in future videos. Also, if you'd like to know how much a junior doctor earns, you might be interested in this video up here. Or if you want to find out why right now is a scary time to be a doctor, check out this video. And I will catch you next time. See ya!